In this video, we're going to talk about one of the most important realities of working in healthcare, and that's stress. Stress is something every healthcare worker experiences, no matter their role or how long they've been in the field. It comes from many directions: high patient volumes, understaffing, long shifts, emotional situations, ethical dilemmas, and the physical demands of the job. These pressures can build up quickly, and if ignored, can impact our job performance, health, and well being. But stress isn't just a problem, it's also something that we can understand, recognize early, and learn to manage in healthy ways. So, in this presentation, we're going to look at why stress happens in healthcare and the workplace realities that you'll face, how stress affects us physically, mentally, and emotionally, and how to manage stress effectively so you can thrive in your career rather than burn out. Think of this as a roadmap. First, we'll shine the light on the actual stressors you're likely to encounter in healthcare. Then we'll explore practical tools to help you handle those challenges with resilience, confidence, and good self care. By the end of this session, you'll understand not just what causes stress in healthcare, but also how to stay balanced, healthy, and grounded while providing excellent patient care. We're going to begin by looking at major factors that contribute to stress in healthcare workers, and we're going to start with understaffing. Many healthcare workers report chronic understaffing. When there aren't enough people to share the workload, each person ends up caring for more patients than is ideal. This can lead to exhaustion, musculoskeletal injuries, and increased errors, all of which contribute to a stressful work environment. The U.S. is experiencing major shortages across primary care, dental care, and mental health. Many communities, especially rural areas, don't have enough providers. And this means existing workers must take on more patients, travel farther, and work under greater pressure. Healthcare has shifted towards doing more with fewer resources. Some departments that once operated only daytime hours now run 24/7, adding more on call time and responsibilities. This job creep increases stress and makes work life balance harder to maintain. Healthcare work is physically demanding. Even with training and proper body mechanics, injuries often occur during urgent situations, like preventing a patient from falling. Long hours, night shifts, and constant movement also take a toll on the body. Burnout is common in healthcare. Heavy workloads, emotionally intense situations, limited sleep between shifts, and the constant fear of making a mistake all contribute to mental and emotional stress. Over time, these pressures can lead to exhaustion and dissatisfaction. Areas like ER and the ICU require rapid decision making, advanced skills, and emotional resilience. Many patients have multiple chronic conditions that make their care more complicated. This intensity can push some professionals towards less demanding roles. When departments are short staffed but patient volumes stay high, workers often pick up overtime or additional shifts. This leads to fatigue, frustration, and a sense that the workload is never ending. The work environment, which includes your team, your leadership, and the overall culture, all have a major impact on stress. Supportive managers and coworkers create a healthier atmosphere, while feeling unappreciated or undervalued increases stress. Most organizations offer an employee assistance program or EAP for support, although these resources tend to be underutilized. Many healthcare workers struggle to balance personal life and work demands. You may be asked to stay late, cover extra shifts, or feel obligated to help your team. Over time, this leads to burnout. Establishing healthy boundaries early in your career is essential. COVID-19 magnified stress for frontline workers. Long hours, Witnessing loss and worrying about personal and family safety created severe burnout. Nearly half of healthcare workers surveyed during the pandemic reported burnout, and many reconsidered their career path. Ethical situations arise frequently in healthcare. You may face disagreements about patient choices, limited resources, or witness actions that concern you. These moments create emotional tension and require strong communication skills and professional judgment. All of what we talked about contributes to stress levels in healthcare workers. And now we're going to shift gears and we're going to talk about stress management. So, stress is unavoidable in healthcare, but unmanaged stress leads to burnout, errors, and poor well being. Our goal is to learn how to notice stress early, understand what's causing it, and develop the skills to manage it before becoming overwhelmed. An example of this is a nurse assistant notices she's rushing through tasks and she feels tense. Recognizing early signs helps slow her down. Breathe and ask for support instead of pushing to the point of mistakes. To cope effectively, healthcare workers must balance personal needs. This includes sleep, nutrition, boundaries with professional responsibilities. Ignoring one area, like sleep, quickly affects the others. An example of this is a medical technician working back to back shifts that might sacrifice sleep, which then affects judgment, their mood, and also their health. Managing stress allows you to provide safe, compassionate care while also protecting your mental health. The goal isn't to eliminate stress, but to prevent it from taking control of your work or your personal life. An example of this is a phlebotomist may feel pressure during busy mornings, but good stress management helps them stay calm and focused rather than anxious or irritable. Stress is the body's natural reaction to demands or threats. Stressors are the things that cause the stress, like workload or difficult patients. Pressure is the feeling of expectation. Understanding what you can and cannot control helps prevent unnecessary frustration. An example is a nurse can't control patient census, meaning how many patients are in the hospital, but that person can control their time management and when to ask for help. Daily stressors such as shift changes, workload, emotional moments, these all create physical and emotional reactions. Sometimes we use defense mechanisms like denial or avoidance, but healthy awareness helps us respond rather than react. An example of this is a provider may emotionally shut down during a traumatic case. Recognizing this helps them seek support afterwards. Stress often starts before the shift even begins. Traffic, lack of sleep, or personal health issues. Once at work, you may face patient needs, emergencies, or a chaotic environment. These add up quickly if not managed. So, an example of this is a respiratory therapist is stuck in traffic, arrives late, and then begins their shift already anxious and already behind and feeling stressed. And then that carries over into their shift and how they're responding to circumstances in their workplace. Not feeling fully prepared or handling patients who are aggressive, confused, or critically ill can create significant stress. Feeling helpless, like when a patient is declining despite your efforts, can be emotionally draining. An example of this is a new CNA may feel overwhelmed caring for a confused patient who keeps trying to get out of bed, knowing that they're a fall risk and they may fall down and they may be blamed if that patient gets hurt. Stress doesn't disappear when you clock in. Family issues, relationship problems, and social conflicts follow you to work. Managing personal stress is vital so it doesn't affect patient interactions or your own emotional well being. An example of this is a caregiver struggling at home may find it harder to stay patient with difficult cases at work. Burnout develops gradually. It starts with ongoing stress, becomes exhaustion, and eventually leads to emotional shutdown. Recognizing early signs like dreading work or feeling detached helps you intervene before it becomes severe. An example is a nurse who begins feeling numb around patients or cynical about care may be entering burnout and needs support. Healthy coping strategies include exercise, talking to coworkers, mindfulness, proper rest, and asking for help. Avoid negative coping like skipping meals, ignoring stress, or using substances. Some stress can motivate productivity, but unmanaged stress harms performance. So, for example, do take short mental breaks, practice deep breathing, debrief with a colleague. Don't bottle up emotions or isolate yourself from others or push through exhaustion. Healthy stress, that's feeling a little pressure before a procedure and it can sharpen focus. But unhealthy stress is that constant feeling of being overwhelmed that leads to mistakes. As we finish, remember that stress in healthcare is normal, but how you manage it makes all the difference. We've covered the main sources of stress and the healthy ways to respond, from recognizing early signs to using positive coping strategies and setting boundaries. You can't control every situation, but you can control your response. If you practice these skills now, you'll be better prepared for the demands of the healthcare field and able to care for patients without sacrificing your own well being. Thank you for being a part of this session, and I hope it helps you move forward with confidence and resilience.